Today, on World AIDS Day, we're remembering the 35 million people who have died from this wretched disease. I am remembering my beloved friends, comrades, and the people with whom I worked in humanitarian projects. I'm also here to stand up for those who will bear the brunt of these horrible, disastrous, damaging policies from this incoming administration. I'm also here to amplify the voices of those in places like Haiti to say that these political games, based on the ideology of the radical right, are playing with people's lives.
Right. Yeah.
We cannot let history repeat itself. After the earthquake in 2010, I saw firsthand the impactful and the effectiveness of programs that were funded by PEPFAR, such as for preventing the mother-to-child transmission of HIV. One of the women that I met was Gerline. She was widowed, she had no family after the earthquake, she was pregnant and HIV positive. She was living in a makeshift house that was put together with tin sheets and tarps that were donated by different agencies. She was living on the outskirts of Port-au-Prince in Cité Soleil. It is one of the most densely populated and one of the poorest slum areas in the Western Hemisphere. At the time, the HIV prevalence rate in Cité Soleil was 8% versus 2% in the rest of the country. So the humanitarian organization that I worked with relied on PEPFAR funding for its maternal health center, which was located near Gerline's house. We monitored Gerline during her pregnancy. We made sure that she received the ARVs during her pregnancy to prevent the transmission of HIV to her baby. And I remembered when we got the panicked call, when we knew that she was going into labor, we arranged for the transport to get to the maternal health center. We made sure that the baby received postpartum ARV drugs at the time of delivery. And we found that she and her baby had survived, and the baby was HIV negative. Exactly. The maternal health center, the staff, the materials, the medications, they all relied on PEPFAR funding. And it was because of PEPFAR that she was able to receive the ARVs that she needed during pregnancy. Gerline continues to live a relatively healthy life, and she's able to raise her daughter. Unfortunately, Gerline's story is too rare, and it must become more common if we are to end the global HIV epidemic. The following year, PEPFAR funding was interrupted in Haiti, which had dire consequences for our project. Shame, exactly. For a number of reasons. The 40,000 patients that relied on our maternal health and family planning services were cut off, and some of those patients had to find other ways of getting their ARVs, and we can't be too sure what happened to those children and how many were put at risk. We are at a critical moment when we need to secure sustainable global AIDS funding and to protect the U.S. healthcare system from further cuts.
Right.
Yes!
After 35 years, we are so close to seeing an end to this godforsaken, horrible epidemic in this country and around the world by 2030. Yes, I'm angry because we are sliding backwards.
We're angry.
Global funding falls short $500 million, which will derail our efforts to reach UN AIDS targets. We are at risk of losing Medicaid, Medicare, and the insurance reforms offered under the Affordable Care Act. We have empowered Big Pharma to back dangerous legislation like the 21st Century Cures Act that does not address high drug prices and access, rather threatens essential steps to ensure drug safety, weakens the regulatory power of the Food and Drug Administration and other agencies that are critical for drug development, such as an HIV curative vaccine one day. Paul Ryan is a hypocrite. As you may know, he went to public school, he received social security benefits to fund his way through college, and he went to public university. Now he's out to dismantle the very government supports he used to get ahead of in life. Tom Price has broken his Hippocratic oath to do no harm. Now he wants to deny reproductive rights to women and thinks LGBT rights have negative effects on health. Shame! Shame! Paul Ryan and Tom Price are bad for our health. The side effects include increased new infections of HIV, reduced number of people who can access meds like PrEP and PEP to prevent HIV transmission, increased maternal to child transmission of HIV, increased HIV/AIDS-related deaths, and overall increased mortality across disease groups, as well as increased medical debt, homelessness for those who lose homes due to the debt,